Hi guys, my name is Caroline Stoner and I'm going to talk about hereditary breast and ovarian cancer syndrome. Hereditary breast and ovarian cancer syndrome, otherwise known as HBOC, is an inherited disorder in which the risk of breast and ovarian cancer is higher than in the general public, often considerably. HBOC is caused by inherited mutations in genes that control tumor suppressions in certain parts of the body. Individuals with HBOC have a genetic predisposition to breast and ovarian cancer. HBOC also increases your risk of developing cancer of the fallopian tubes, peritoneum, prostate, and pancreas. But in full, HBOC syndrome is associated with early onset breast cancer, triple negative breast cancer, bilateral breast cancer, ovarian cancer at any age, prostate cancer, pancreatic cancer, melanoma, a secondary primary cancer, and cancer recurrence. Dr. Mary Claire King is the American Cancer Society's professor of genome sciences and of medical genetics in the Department of Medicine at the University of Washington. She is credited with discovering the breast cancer genes, BRCA1 and BRCA2. From 1974 to 1990, Dr. King carried out years of research determined to find a genetic marker or identifiable gene that accompanied the presence of breast cancer in families with a history of breast cancer. In 1994, her research team isolated the BRCA1 gene and then isolated the BRCA2 gene in 1995. Her discovery of BRCA1 and BRCA2 revolutionized the study of numerous other common diseases. And her discovery also led to the development of blood tests to screen for mutations in those specific genes. Because it's a hereditary disease, the main risk factor for HBOC is genetics. There's a 50% chance of inheriting HBOC if a parent carries a BRCA mutation. A woman's risk of breast cancer is 2 or more times greater if she has a first-degree relative who was diagnosed with breast cancer before age 50. The younger that relative is, the higher the risk is for family members. And that risk increases about 4 to 6 times if the individual has 2 family members who are diagnosed with breast cancer before age 50. It's important to note that age is not a factor. Although one's risk of cancer generally increases with age, HBOC is a genetic determinant of health. Most breast cancers due to genetic mutation occur before age 65. And since HBOC is an autosomal condition, sex is not a risk factor either. This graph shows the prevalence of cancer in the general public compared to those with risky genes or those with HBOC. Certain ethnic groups have a markedly elevated risk of HBOC than others. Most notably, Ashkenazi Jews have a much higher rate than the general public. This can be identified as a result of the founder effect, which is the loss of genetic variation that occurs when a new population is established by a very small number of individuals from a larger population. And then this is the result of a study done by Stanford University that tracked breast cancer genes in racial groups in Northern California. As you can see, Ashkenazi Jews have the highest rate in that area. Other research has shown that individuals of Bahamian, Norwegian, Polish, African, Dutch, East Indian, and Icelandic ethnicity are at a higher risk of inheriting HBOC as well. So what causes HBOC? Genetic abnormality. HBOC is caused by a deleterious mutation that causes the BRCA1 and BRCA2 genes to work incorrectly. The inheritance of these risky genes significantly increases one's probability of developing breast and ovarian cancer later in life. BRCA1 and BRCA2 mutations account for about 5 to 10% of all breast cancer cases and about 10 to 15% of all ovarian cancer cases in the world. So in other words, about 5 to 10% of all breast cancer and 10 to 15% of ovarian cancer is hereditary due to these gene mutations. And then inheritance. HBOC is an autosomal dominant disease, and the BRCA mutation can be inherited from either the mother or the father. Because of this, they're classified as germline mutations, and you only need 1 copy of the mutation to be at risk. So people with a first-degree relative with a BRCA mutation have a 50% chance of having the mutation too. And this little diagram here at the bottom of the slide just shows how the gene would be passed on to children. So this just shows that of the general population, there's just a small amount of people that carry the hereditary disposition to breast cancer. Researchers estimate that 1 in every 300 to 500 individuals in the general United States population has an HBOC genetic mutation. The number rises in the Ashkenazi Jewish population, so 1 in every 40 individuals. And like I said, it's a result of the founder effect. And then I live in Michigan, so I was curious to how many people in this state are carriers of a BRCA mutation. The Michigan Department of Health and Human Services estimate that there are currently around 25,000 individuals in this state who have HBOC. Because HBOC is a hereditary disease, there aren't very many signs and symptoms other than cancer itself. But that being said, there are some red flags that can identify HBOC among individuals. These include having a family member diagnosed with breast cancer before age 45, ovarian cancer in the family at any age, having a family member with both breast and ovarian cancer, having a family member with bilateral breast cancer, and also having a history of male breast cancer in the family. So for diagnosis, genetic testing is available to test for cancer-causing gene mutations. Often these are done by collecting a blood or saliva sample and having it studied under a microscope in a lab. Scientists use your sample of DNA to identify genes and then test for genetic diseases. BRCA1 is located on the long arm of chromosome 17, and BRCA2 is located on the long arm of chromosome 13. Both genes are really large, and mutations can occur at almost any position. This means that molecular screening for a first-time individual can be very technically demanding. And then panel tests, which include broader genetic testing other than the BRCA genes. They're also encouraged for most individuals, but they're generally more expensive and less available. Genetic testing is the first and foremost preventative measure one can take against HBOC. Knowing your genetic makeup puts the power in your hands and allows you to make the best decisions for yourself now and in the future. Screening tests are also an important preventative measure. Breast self-exams, clinical exams, yearly MRIs, mammograms, pelvic exams, and transvaginal ultrasounds for women, and prostate exams for men are all encouraged screening tests. For those who test positive for HBOC, there are some other options. Risk-reducing surgeries offer individuals the ability to prevent cancer from occurring later in life. A prophylactic bilateral mastectomy is the preventative surgical removal of both breasts, and it can reduce an HBOC-afflicted individual's risk of breast cancer by more than 90%. A prophylactic salpingo-oophorectomy is the preventative surgical removal of ovaries and fallopian tubes, and it can reduce an HBOC-afflicted individual's risk of ovarian cancer by almost 96%. If completed in premenopausal women, this surgery is also associated with a 50% decreased risk of breast cancer. Chemoprevention is the use of drugs to stop or keep cancer from developing. Tamoxifen, taken for 5 years by women at high risk of breast cancer, can reduce that risk by 50%. Raloxifene and AIs are also effective for breast cancer prevention in women who are at high risk. And oral contraceptives, taken for 5 years by individuals with one of the BRCA mutations, may be associated with a decreased risk of ovarian cancer by about 50%. Those with HBOC should know that they're not alone. The disease is becoming increasingly more well-known, and the support network is expanding every day. So for individuals, genetic counseling is a process used to evaluate and understand a family's risk of an inherited medical condition. Cancer genetic counselors, geneticists, and risk assessment counselors are healthcare providers with expertise in cancer genetics and training in the use of specialized tools and statistical data to estimate individual risk for inherited cancer. They will recommend appropriate options for screening and management of cancer risk, and when cancer has already been diagnosed, treatment or follow-up care. Research has shown that genetic counseling reduces breast cancer worry, anxiety, and depression, increases understanding of risk, and decreases intention for inappropriate mutation testing. Family planning options are also available for individuals with HBOC. Prenatal testing can help determine if a child will be born with the gene mutation, and fertility treatments like in vitro fertilization can help screen embryos before implantation in the uterus to ensure the fetus is not a carrier of the mutated genes. There are large global support networks for individuals with HBOC. The HBOC Society provides supportive connections and essential information about specialized services and resources to those in the HBOC community. And then Facing Our Risk of Cancer Empowered, otherwise known as FORCE, is another large support group whose mission is to improve the lives of individuals and families affected by hereditary breast, ovarian, and related cancers. Force members also coined the term cancer previvors, which is used to describe survivors of a predisposition to cancer but who haven't had the disease. Previvors often elect for treatment options before developing cancer so as to beat the disease before it beats them. And then local to me, BRCA Can't Stop Me is a student group here where I live in Michigan at Grand Valley State University. And their mission is to raise awareness of the BRCA gene mutation among young adults and to provide support for young adults who have or are affected by the BRCA gene mutation. There are many resources available for assessing one's risk of HBOC. The U.S. Preventive Services Task Force is an independent volunteer panel of national experts in disease prevention and evidence-based medicine. The task force works to improve the health of all Americans by making evidence-based recommendations about clinical preventive services. On their website, you can view their full summary of recommendations and evidence for HBOC treatment, which is continually updated as more research becomes available. As you can see, the task force assigns a letter grade to a recommendation for each different population, with A being the most recommended and F being the least recommended. The Centers for Disease Control and Prevention offers educational resources about HBOC on its website as well. The CDC's Bring Your Brave campaign provides information about breast cancer to women younger than 45 by sharing real stories about young women whose lives have been affected by breast cancer. There are some gaps in the full understanding of HBOC. While Dr. King is credited for the discovery of BRCA1 and BRCA2, scientists believe that there are other, possibly many, genes that can cause breast and ovarian cancer when mutated. We don't know exactly all of the cancer-causing genes, so further research definitely needs to be done. As you can see, about 5 to 10% of all breast cancer is that hereditary breast cancer, and then of that, BRCA1 and BRCA2 make up about a third of what's estimated to be the total number of genes that do cause breast cancer. Additionally, because full genetic panel testing is fairly new, the specific set of genes assessed for mutations can vary from test to test. Sometimes individuals will receive a false positive test result for a BRCA mutation, which then causes stress and unnecessary treatment. In terms of research, our priority should be on education empowerment and future health of individuals with HBOC. BreastCancerTrials.org is a custom matching service to help find clinical trials for people with BRCA mutations. These individuals could opt to participate in medical trials and volunteer as research subjects for future medical advancement in the cancer field. The National Institutes of Health also has clinical trials available for individuals with HBOC. The research published by the NIH can be used by both medical professionals and the general public to make informed decisions about HBOC. This picture is an example of a proposed new clinical trial designed for patients with breast cancer. It was published on Medscape. In terms of interventions, population-based screening is an effective way to identify high-risk women before they receive a cancer diagnosis. The Georgia Breast Cancer Genomics Project showed success when using preliminary screening by public health staff to determine patients' risk of HBOC. The earlier one becomes aware of an HBOC diagnosis, the better chance of successful treatment later on down the road. National HBOC Awareness Week is another intervention that we should be prioritizing. There's millions of people who have a BRCA mutation but don't know it, so a national campaign like this is crucial for spreading awareness. Genetic testing is also a huge intervention that we should be focusing on. Under the Affordable Care Act, insurance will pay for testing and genetic counseling if people meet certain criteria identified by the USPSTF. In situations not covered by the ACA, insurance will still usually pay for testing, but it can be kind of expensive. On average, genetic tests for HBOC cost anywhere from $200 to $1,000. However, there are some independent genetic testing companies that offer family rates and discounts. Color.com is a pretty well-known company that offers reliable genetic test results done at the convenience of your own home with a saliva sample that you then send them in the mail. Color.com tests for a variety of different things, so you can test your genes for more than just BRCA mutations. It's important to note that while more insurance companies are beginning to cover genetic testing, not all insurance companies do or will cover it. Furthermore, some health insurance companies can deny you coverage if you test positive for a BRCA mutation. Nevertheless, there is the Genetic Information Non-Discrimination Act, GINA, that prevents health insurers from using genetic testing to discriminate against individuals, but that's not always been the case. Cancer is scary, but being informed can help you better prepare for the future. It's important to know it's manageable. An HBOC diagnosis is not a death sentence, and you're definitely not alone. Thank you.